Okay, this is Victoria doing her medication aerosol checkoff video. Go ahead, Victoria.
Okay, my requisition comes down. I have to give a bronchodilator to Daryl. So I'm going to grab all of my equipment. And my requisition, and I'm going to go down. I'm going to check the patient's chart. I want first date, medical record, and patient's name. I want to make sure that the physician's order's in the chart as well. I want to make sure, see if they're allergic to any medications, if they've had the medication before, why they're here. Want to check x-rays, any significant findings, see if there's anything I need to know as far as this medicine treatment goes. I'm going to take all of my equipment and I'm going to... Hi, I'm Victoria. I'm from Respiratory. I'm here to give you a breathing treatment today. I'm going to wash my hands. I'm going to wash my hands. All right. Can you give me your name and date of birth, Daryl?
Daryl Walters, May 26, 87.
All right. I'm going to make sure that's what I have in my chart and it's correct. Have you ever had a breathing treatment before? You haven't? Okay. What it is, your doctor ordered for you to have a breathing treatment. It's going to be, and I'll set it up and show you, but it's a little something. You just put this part in your mouth. And you're going to be able to see the mist come in and out as you breathe. We want you to breathe normally. And periodically I'll tell you to take a deep breath and hold it there because we want to make sure all that medication is getting in there. Sometimes some people feel a little dizzy or lightheaded. Just let me know if you do. Sometimes it can cause some tremors or jitters, kind of make you a little nervous. But again, just let me know. It's not very common. Before we do that, I'm also going to do a little peak flow with you. This is going to measure your lung volume, see if they improved after your treatment. I see that yours is already set up here, so we're going to do that first. And I'll set this up and show you a little bit before I actually give it to you, okay? Do you have any questions? No? So you have some family in the room. Is that okay if they stay? Okay, do y'all have any questions?
Yeah, we have one. What kind of medication is he going to be getting? Was it the Prevenal stuff?
It is
Prevenal?
It's Prevenal. It's a bronchodilator. What it's going to do is kind of open up your airways for you, help you breathe a little bit better.
Okay, good. Okay, I think that you were saying you were short of breath. That should help.
All right, I'm going to check heart rate, respiratory rate, SAC, color, level of dyspnea. I'm going to listen to breath sounds as well. I'm going to put this on your finger. There you go. Check your saturation. I would check your heart rate. And I would also check breath sounds. We're going to do, if you'll sit up for me and take some good deep breaths. Take a deep breath. Back and listen as well. Good deep breath. I'm going to listen on the side too, okay?
How is his breath sounds?
Breath sounds, he has a little crackling down there. Probably needs to open up a little bit. I'm going to check his heart rate.
And how are you doing that?
I am counting his, checking radially, feeling his pulse, and I'm counting in 15 seconds, and I can multiply it by 4 unless I feel arrhythmias, in which case I would go the full minute. Okay.
And what number
80
did
beats per minute.
80? So you counted how many in 15 seconds?
20.
20. And so his breath sounds were some slight wheezes with a little bit of crackles. His saturation was what?
Was 95.
95. And his respirations were?
His respirations were 12.
Okay. And how would you measure that? Can you show me?
Yep, I would. Better way to do it would be put your hand on the back and just watch in 15.
And you want him to breathe what?
Normally. That time it would have been 14 in a minute.
Okay. How does this color look to you?
He looks all right. Little pink, got a little peachy pink going.
And
Okay. And
how's his breathing?
got a little rough breathing going. Probably needs a little something to open him up a little more.
Okay.
How
And
do you feel? Probably on a scale of like 1 to 10. 10 being the worst as far as your breathing goes. What do you think?
5, shortness of breath.
5. Okay, so about in between. All right. That's all right. This will probably fix it, make you feel a little bit better. You ready? Do you have any more questions? Okay. All right, I'm going to go ahead and set this up.
honey, wasn't it earlier you were saying that you coughed up some stuff?
Yeah. Look.
Oh, okay. Yeah, that'll happen. Did you cough up a lot? Was that the first time you coughed that up?
Yeah.
Yeah? All right.
When you're done, can I try blowing in that blue thing too?
I haven't gotten there yet.
I just want to try it. What's
Not
his is
his.
mine, what's mine is his.
Not in his. Probably better to let him do that so we don't get any more germs in there.
Oh, so you don't want me to touch it?
Yeah, we don't want him to get any more sick. I don't even want to touch it. It's not good.
We'll just wait for her to leave.
Alright, now that I have it set up, see it looks a little funny, but you'll breathe through here and you'll see some of the mist come out of here, and your medicine's going to be in here, and it'll kind of bubble and sputter and stuff like that, and then I'll tell you how to breathe when we're doing it, okay? Alright, so the first thing we're going to do is your peak flow, and that again is checking the volume. We want to see how well you can do it. So I'm going to pull this red thing down, and what you're going to do is you're going to hold it like this in your hand, whichever hand's more comfortable for you. What you want to do is make sure your lips are around it, your tongue's on the bottom. Bite down is probably the best thing to help you. You want to make sure you try to stay straight. If you need me to hold your shoulders back, that's fine. We can do that. And you're going to take a deep, 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 deep breath in, and you're going to out. The best that you can without going forward, okay? We're going to do this 3 times, okay? All right.
Oh, this looks like fun. This looks like fun.
All right, and take a deep, 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 deep breath in and blow out. All right.
Baby, you can blow better than that.
We got about 440. I think you can do better. Let's try to put it a little further in your mouth and bite down a little harder, and that might help better. So take a deep, deep, deep breath in and blow out. There you go.
There you go,
That's
son.
much
That's the
better.
way. That's a chip off the old
There
block.
you go, 540. I think you can do a little better.
That's
than
my
that.
son.
Let's try it again. Take a deep, 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 deep breath in and blow out. Got 550 that time. Good. All right. So we're going to say 550 is your best. We're going to hopefully get this treatment in, and it's
Man, I'm
gonna
proud of you.
make it better, okay? All right. And this is just your medicine that I'm putting in here. we're gonna put this on, and I'm gonna turn this on, and you're gonna see the mist come out.
So Victoria, it doesn't matter if you use oxygen or air.
No, you should use oxygen. We just don't.
But does it matter?
Oh no, not really. Not unless the patient really needs it.
And what flow rate did you set it? I can't see
I
because
have
of that
it on
tape.
7, but it should be between 6 and 8.
Okay, and that's set by who?
The therapist, it depends. Oh, the 6 to 8?
Yeah.
That's set by the ARC, the company that did this.
Yeah, the manufacturer. Very good.
Alright. And we'll put that in your mouth, and you're just going to take some normal breaths. I'm going to come on this side. You're just going to take some normal breaths for now. Just breathe normally. Good job. Alright, in a second, I'm going to tell you to take a deep breath in and hold it. And then when I tell you to let it out, then you can let it out, okay? You feeling alright? Alright, let's do this. Take a deep, deep, deep breath in. Deep, 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 deep. Hold it, hold it.
Hold it, son. Hold it, son. Hold it, hold it, hold it.
Alright, and let it out. Good job.
All right, son. I bet
How
you
you
he can hold
feeling?
it longer than that. Why is he holding it, Victoria? Why is he holding it? Why is he holding a deep breath in? What's he trying to do?
Oh, you're trying to make sure all of the medicine gets all down in your lungs, and you hold it there and pop some alveoli open and hope that it kind of gets way, way down in there.
Oh, I remember seeing something about that. So deposition and sedimentation, where the medication rains out because there's no flow.
I want to make sure it gets down in there.
Man, you did that good, son.
You still feeling alright? Not lightheaded or anything? Good. Alright. Breathe normal. Now let's try that one more time. We're going to take a deep, 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 deep breath in. Deep, 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 deep. Hold it, hold it, hold it, hold it, hold it, hold it. Alright, and let it out.
It's starting to sputter right now.
Alright, and since it's sputtering, let me see that for just a second. I want to make sure we get all that medicine in there. There you go. I want to try to take a deep breath again, but I'll give you a second. You might be a little lightheaded from doing it a couple of times.
Not my son.
Think you're ready? Alright, we're going to take a deep breath in. Ready? Deep, 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 deep. Hold it, 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 hold it. And let it out. Good job. Still doing alright? Yeah? Okay.
It stopped misting completely.
Alright, let's see that. How you feeling?
Good, good.
Feeling okay? Alright. I'm going to get you to cough for me in just a second. Let me... Thank you. Alright. While I'm cleaning this out, could you do me a favor? And I want you to cough good and hard. I want you to get it way out of there. You're going to cough and you're going to when you cough, okay? And if anything comes out, you show me, alright? Okay. Get a good cough. Alright, good job. Get anything? Oh, got a little green in there. That's alright. Getting some stuff up.
That was very smart, Victoria, to move out of the way when he was coughing, so you wouldn't get coughed on. That was excellent. What are you doing there? You're putting saline in there?
Cleaning out
Okay.
this. I'm going to dry it out.
And Daryl, inside that paper towel, what would you be looking for?
The texture of the mucus or the sputum.
CCA?
Color of it.
CCA. Victoria?
Color, consistency.
Taylor?
Accumulation?
Amount.
Huh?
Yeah.
CCA.
Consistency and
Amount.
amount.
Alright. And now that that's clean out, I'm going to put this in your bag for you. So, whenever you have another therapist that comes in, I'll be your next one, probably about 4 hours, but we still have a few things to do. But, so your other therapist has it, okay? Alright. I'm going to let you throw that away. Thank you. Still feeling alright?
Yep.
No jittery, nothing after the fact? Good, good. That's what I like to hear. We're going to do the peak flow again. I want to see if you got any better. We're going to really do it this time. You're really going to blow into that, alright? Got to take some good deep breaths for it. Alright. deep breaths. Ready? And deep, 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 and blow out hard. That's pretty good. You got 550 on the first try. Let's try it again. Let's see if we can get way up there. Deep breath. Deep, 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 and blow it all out. Good job. 610. Let's try it one more time. See if we really open it. Really deep, really deep, really deep, really deep. 610 again. All right. Good job. Yeah, we definitely opened that up a little bit. You feel a little bit better? Good. All right. I just want to, I'm going to check your heart rate again.
That's good.
I would check your saturation again.
98%.
Perfect. Good. Check your respiratory rate again.
14.
Alright, still that's probably about normal for you. That's good, that's good. And color, still looking pretty pink, that's good. And how are you feeling as far as your breathing goes? Do you feel a little bit better?
Yeah, I feel a 7 or 8 now.
Feeling worse?
Feeling better.
Feeling better, so probably a 2 or
Yeah.
3 on the other. Okay, alright. I just want to make sure. Alright, so let's see, that was dyspnea, and then I'm going to listen to you again. I want to see if maybe we kind of opened up a little bit more, okay?
And you would listen to what? Show me how you just move the
Can't hear
step.
you, sorry.
Show me how you would just move the stethoscope
Okay.
around.
I'm going to listen again. Here.
So you're going from side to side. And Daryl, how are you breathing?
Normal.
Through my mouth,
With your mouth open.
in and out.
And you need to make sure you're feeling ribs. You don't want to go below the ribs. And remember, it's side to side because you're doing a comparison. If you're checking a patient's breath sounds on a ventilator, you always want to check the breath sounds on a mechanical breath, not a spontaneous breath.
Alright, and I checked your breath sounds. You just got more wheezing going, which is good. That means we're opening up those airways. You don't have as many crackles, so you probably coughed some of that up whenever you cough. That's excellent. That's definitely what we want to hear. Are you feeling okay? Do you need anything? No? Okay. I'll be back probably around 4 hours, somewhere around there. Let's see, so it's, 1:20 now, so probably about 5:20, somewhere in there. Somewhere there, it might be a little before, a little after. If you need anything, you just let your nurse know. Family have any more questions?
No.
No? Okay.
He looks good. I'm proud of my son.
All right. If you do start feeling a little jittery or anxious, sometimes it happens after. Just let your nurse know. We'll get back up here. Okay. All right. Perfect. And I'm gonna leave this stuff back in here, and I'm going to wash my hands, and I'm gonna walk out, and I'm gonna chart everything that we did.